Dr. Francis Collins has been at the helm of the National Institutes of Health since well before the start of the COVID crisis. And while he's stepping down, he has no intention of slowing down, as he tells our Rita Braver.
So this building on the left is our clinical center.
One way to see NIH like I've never seen it before. For Dr. Francis Collins, the adventure of owning a Harley is nothing compared with the challenge of running the sprawling National Institutes of Health.
So we have 27 institutes and centers. They range everything from institutes that are focused on a disease, the National Cancer Institute, to some that are focused on organ systems, the National Eye Institute, or infectious disease, heart, lung, and blood. And I've had a pretty good time getting the best people in the world to come and lead those institutes.
But after 12 years on the job, one of the longest runs in history, Dr. Collins will step down today.
I have loved this role, but 12 plus years is a long time to have a single leader of this largest supporter of biomedical research in the world. It's good to have new vision.
It was Collins' own vision as one of the foremost genetic researchers in the country that inspired then-President Barack Obama to appoint him to lead NIH in 2009. Collins helped push through major increases in the NIH budget, now expected to hit $50.4 billion a year.
I have done everything I can to stay out of any kind of political partisan debates because it really is not a place where medical research belongs.
That may be why both Presidents Trump and Biden asked him to stay on. But Collins revealed that once the COVID pandemic began, he found himself facing off with Mr. Trump over Collins' refusal to endorse scientifically disproven remedies like hydroxychloroquine and blood plasma from recovered COVID patients.
And I got into a difficult place and got a bit of a talking to by the President of the United States about this, but I stuck my ground.
Would you have resigned if it had come to the White House trying to get you to do something you didn't want to do?
Yeah, I was not going to compromise scientific principles to just hold on to the job.
And Collins has resisted demands from the right for him to fire one of his key team members, Dr. Anthony Fauci.
Can you imagine a circumstance where the director of the NIH, somebody who believes in science, would submit to political pressures and fire the greatest expert in infectious disease that the world has known just to satisfy political concerns?
Collins is proud of work by NIH scientists that help lead to the development of COVID vaccines. But still,
are there any things that you wish that you and NIH had done differently vis-a-vis COVID?
I wish we had studied more carefully the problem of hesitancy. I did not imagine that there would be 60 million people who, faced with compelling evidence of the life-saving nature of COVID vaccines, would still say, no, not for me.
Francis Sellers Collins, one of 4 boys, grew up in Stanton, Virginia, homeschooled until 6th grade.
My mother and my father had this ability to inspire you about the joy of learning new things.
He got a PhD from Yale and an MD from the University of North Carolina. In 1989, he helped discover a gene that causes cystic fibrosis. Then in 93, Collins was recruited to join NIH, where he would head up the government's effort in the race with a private company led by Craig Venter to map the human genome, all the genetic information in our DNA.
All of this got into the People magazine version of science that I'm not sure was all that helpful, but ultimately it had a good ending.
In 2000, President Bill Clinton declared it a tie.
Today we celebrate the revelation of the first draft of the Human Book of Life.
In 2007, President George W. Bush presented Collins with the Medal of Freedom, in large part because of strides that mapping the human genome made in treating diseases like cancer.
what particular genes are mutated that is causing this problem to happen. And how could we look at the menu of all the kinds of interventions we have, drugs, immunotherapy, and pick the right match for your cancer? The Genome Project made that possible.
And even after he became director of NIH, Collins continued to do research.
Yeah, this is the special part of it for me.
Here in the lab where he plans to return when he steps down as director, focusing on diabetes and a new gene editing technique to help kids with a rare disease called progeria that causes premature aging.
We're now trying to figure out how in the next months or maybe a year to do all the necessary work to start a clinical trial on kids with that condition to see what we can do.
Collins' partner in all of this is his wife, Diane Baker, a pioneering genetic counselor.
So do you just sit around the dinner table and discuss the latest genetic developments?
Actually, we do.
We kind of do.
In fact, Baker has become deeply involved in charities that support patient care at NIH.
I mean, we both care so much about healthcare and access to healthcare and biomedical research, and we know it's all intertwined and necessary.
What do you think are the qualities that define your husband?
That's an important question. The qualities that come to mind are he is totally himself. He is totally who he is, and he brings everything he has to his work. His humor, his intellect, his music, his concern for people. He brings it all.
Okay, I'm going to cry too.
The music his wife mentioned is indeed a key to understanding Dr. Francis Collins, whether it's playing a concert with a young sickle cell anemia patient or performing with other NIH experts.
So why do a bunch of very hardworking doctors and scientists want to have a rock and roll band?
Because it's good for your soul.
But Dr. Francis Collins will never stop searching for the next medical breakthrough.
'Cause I'm not